So today we will discuss about the urinary bladder and the anatomy of the urinary bladder. So first of all, the urinary bladder is the most anterior element of the pelvic viscera, and behind the urinary bladder in females is the uterus, and behind that is rectum, and males behind the urinary bladder is the rectum. And the urinary bladder is situated in the pelvic cavity, and the shape of the bladder is shaped, it's like a tetrahedral in shape, it's like a pyramid, and it has an apex and a base, and it has a superior surface and two inferior lateral surfaces. Yes, so here is the apex, and this part which is situated posteriorly, this triangular part, is the base. So this is the base, this is the apex, and this surface is the superior surface, and on each side below is going to be the inferior lateral surfaces. The bladder is shaped like this sort of pyramid, and when it is empty, it is within the pelvic cavity. However, when it expands, it fills up with urine, then the full bladder actually extends within the abdomen. uh, here is the empty bladder, and when it's filled up with urine, then it expands above into the abdomen. It also has like four borders. It has an anterior border, it has an anterior border, and it has a posterior border, and it has two lateral borders, right? So the apex of the bladder, which is this part right here, it is actually directed towards the top of the pubic symphysis, and it's actually attached to a structure which is known as the median umbilical ligament. And the base, which is sort of an inverted triangle, which is represented over here, the base is has 2 points where the two ureters are entering, these 2 points where the two ureters enter from above, and a point below from where the urethra exits. So the base is sort of this triangular structure, and it's located bit posteriorly, and from within the inside, as is shown in this diagram right here. From if you cut the bladder and you see within, then you will see this triangular smooth area, which is known as the trigone. Elsewhere the bladder, there are mucosal folds, as can be seen here. These mucosal folds, like, these are known as rugae, and these are irregular folds on the surface of the bladder. And however, in the area of the trigone, which is this area, so in the area of the trigone, which has been labeled here as well, in the area of the trigone, the surface is smooth because the mucosal lining is firmly adherent to the underlying smooth muscle. So this small area, this triangular area from within, this is the inside surface of the base, is known as the trigone. Okay, so now let's move on to the neck of the bladder, right? So the neck is fixed in position by these ligaments which are shown here. We have, in the females we have the pubovesical ligaments, and in the male we have the puboprostatic ligaments, because in the females the urethra will continue from the bladder down, directly. But in the males, the urethra is going to pass through the prostate, and it's going to have actually four parts: the pre-prostatic urethra, the prostatic urethra, which passes through the prostate, and then the membranous urethra, which passes through the deep perineal pouch and the perineal membrane, and finally the spongy urethra, which has a bulbar part and a penile part. But we're not discussing that here. We're discussing about the neck. So neck is this region which is right under. So neck is this region which is right from where the urethra will begin, and it is going to be fixed in position because of these ligaments. The pubovesical ligament is going to extend actually from the back side of the pubis, and it is going to surround this part. So this is the pubovesical ligament, and it's found in the females, and in the males we have this ligament which blends with the fibrous capsule of the prostate. So this is the puboprostatic ligaments in males. Right. And then in order to visualize the inside of the bladder, we have these special techniques which special technique which is known as cystoscopy. It is just like an endoscope which is inserted via the urethra, and so we can see the inside of the bladder. And this technique is done basically from the urethra. The cystoscope would be entered. It has a camera attached to it and a light source, and it can be entered via the urethra into the bladder, and then the bladder can be assessed for things. It can be assessed for example, polyps or tumors, and a biopsy segment can also be taken. Now let's talk about the mean capacity of the bladder. As the bladder can fill up and it can expand into the abdomen, so the mean capacity of a bladder in an adult male is about 220 milliliters. 220 milliliters, and it varies from 120 to 320. However, filling beyond 220 will cause a desire in them to micturate. Micturation is just the passage of urine. So above 220 they'll have a desire to micturate, and usually when the filling up to 500 milliliters can be tolerated. However, beyond 500 milliliters, pain will be felt if the micturition reflex is forcefully inhibited using the pontine inhibitory center. We have this for okay. So the nervous supply of the bladder is such that it has an internal urethral sphincter and it has an external urethral sphincter, and there is muscle within the bladder wall which is known as the detrusor muscle. So the only voluntary part is the external urethral sphincter, and the external urethral sphincter can be controlled. It is controlled, basically it is supplied by the pudendal nerve, branch of the pudendal nerve. So that part can be controlled. So if, as long as we inhibit micturition by controlling the external urethral sphincter, we can fill up the bladder up to its full capacity. However, up to 500 milliliters can be tolerated. Beyond that, filling up the bladder would become painful. Now let's move on to the arterial supply. So the arterial supply is from the going to be from the anterior trunk of the internal iliac artery. Sorry about this. Anterior trunk of the internal iliac artery. So the common iliac comes just to orientate you here. This is going to be the sacral part, right? So this is posterior and this is the pubis, so this is anterior. So it is like a cut section from the mid, and this is going to be the posterior, this is the anterior, and so here is the common iliac artery. It is dividing into external iliac and internal iliac. The internal iliac, again, it gives an anterior trunk and a posterior trunk. Right, so so here only the anterior trunk of the internal iliac has been shown, and it can be seen that the branches of the internal iliac are the superior vesical artery and the inferior vesical artery. So these two arteries actually supply the urinary bladder: the inferior and the superior vesical arteries. Here it can be seen that the superior vesical artery is actually a branch from the umbilical artery. So the umbilical artery, it's actually two parts, right? And one part is it doesn't conduct blood, and it's like a ligamentous structure, and it's known as the medial umbilical ligament. And the second part is an artery, and it is the superior vesical artery.